Power 93.7 WBLK. I'm Yasmin Young. This is the 2 to 6 takeover, and it has been getting very, very, very intense for us as we go through this together as a city, as a state, as a country, as the world in dealing with the coronavirus pandemic. And I've got one of the busiest women, but she is putting in so much work right here in Erie County to make sure that we stay safe and that we can nip this in the bud as much as possible. I'm talking about Erie County Commissioner of the Department of Health, Dr. Gail Burstein. Welcome, Dr. Burstein.
Thank you for having me on.
So let's just talk about where we are number-wise with the cases that are positive here in Erie County and the number of deaths.
Well, we know that every day we're seeing more and more cases reported to us. As of last night, we had over 400. I know we will receive more this morning. And again, we are just testing right now a small portion of our population. Only people working in the healthcare field, our first responders, our EMT, fire, police, people working in congregate settings like at nursing homes or adult care facilities. And so all those individuals are eligible for testing, but there's most of the community is not going to be tested. And so we estimate that there are hundreds and hundreds more people who are truly infected than we're aware of. And then especially since we know that many people have mild or minimal symptoms. I heard from a colleague over the weekend and works in primary care in the South, I think in Orchard Park, and that individual told me that they're seeing cases, people that don't meet what we think are the criteria. Many times they don't have a fever. Many times they don't have any severe respiratory symptoms, and so we imagine that this is pretty prevalent throughout our community. And I don't think you can assume just because somebody looks well doesn't mean that they are not infected.
Absolutely. And I know that Erie County shut down 2 bars that were disregarding the takeout delivery only orders that are in place. What is your message to other bars, to other restaurants who may intentionally or unintentionally be violating these orders, and why these orders are so important?
Well, it's very important that bars and restaurants only provide takeout service and not house a gathering of people inside their facilities. I mean, they are part of the team here in our community to help us with our non-pharmaceutical interventions to keep the numbers as low as possible of people who are infected, so that we'll be able to keep the numbers as low as possible of people who need hospitalization and people who unfortunately die. So a restaurant and a bar is a place where people can congregate. There will be a lot of people together in a closed space. And so the message is very strong. We will not allow it. This is violating the governor's order, and we are enforcing this on behalf of the governor. And so any restaurant that we find is serving people inside the facility, even if they're serving them while they're waiting for their takeout orders, will be closed down. We are working with law enforcement to do that, and we have successfully done that in a couple of instances. And then also we are reporting those restaurants or bars to the New York State Liquor Authority, and we're encouraging the Liquor Authority to take some punitive action. And also these restaurants will have to prove to us, they'll have to give the health department a plan so that we will have to approve about how they will be able to stop food service within their facility and only provide takeout service. If the weather's not good, they can they can have people wait in their car and then call them on their cell phone when the food is ready. They come by and to a window and collect it. People can also hopefully many places are allowing people to order online and pay for it online, so there doesn't have to be any exchange of money or any credit card. So again, we have to be innovative and resourceful. And again, that means not going into any type of restaurant or bar establishment and creating a gathering that can infect each other.
Absolutely. And yesterday, Buffalo Common Council President and Pastor Darius Pridgeon announced that he tested positive for COVID-19. Of course, we're praying for his speedy recovery as well as everyone else who's been affected by this. But I think it highlights a very important point that you can expound upon, that this virus can affect anyone.
Yeah, it can affect, this virus can and will affect anyone, that especially if they don't adhere to the social or personal distancing or physical distancing, if they don't do their hand washing very frequently, if they touch surfaces that haven't been washed. I mean, that if they go near people that have been sick, I mean, that's what can happen. And even if people do participate in all those non-pharmaceutical interventions, I mean, there could be somebody that you're very close with that lives in your household that is infected and may not have symptoms that you might be exposed to. So this can happen to everybody. We're seeing it all throughout the county. We're seeing it in the suburbs. We're seeing it in the city. We're even seeing it in New York State and Erie County, officials, people working in government. So this does not discriminate. It's unfortunately seems like it's as common as what we call a common cold, although the consequences are much more serious.
Absolutely. How can parents protect their children? You know, it's hard enough to get us adults to follow hygiene protocols and guidelines, but how can parents keep their kids safe and keep their kids healthy and well during this time?
So it's a challenge for parents to keep their kids safe and healthy. They can an activity could be washing your hands, and I know that schools are closed now, so another activity could be helping their kids with their homework and online learning, because that's tough, especially for a young child. And again, maybe organizing virtual plays dates with neighbors, and so kids can get on the computer and maybe FaceTime in a group, so they can have those type of opportunities, and maybe have coloring contests or something, and they could show each other on their phones or on the computer what they've drawn. So we have to be creative in these times, and it's really, really tough. But with kids, it's tough to get their hands washed, and so that's something that we really have to focus on, and helping our kids learn those behaviors, and also help remind us about doing this ourselves, and also making sure that toys are washed down very frequently, because that's a way that even infection can transmitted in the home is by kids sharing toys. So all those things are really important, and I know it's tough for parents to keep kids well under normal circumstances, and I understand that it must be very difficult to try to keep kids well under these circumstances. I mean, I have kids myself, and I understand the challenges. And again, hopefully, if we can keep these going, these non-pharmaceutical interventions going for a few more weeks, we will keep the curve down. We'll keep the peak number of cases down and the peak number of deaths down, and we'll be healthier at the end of it.
What do older adults and people with disabilities need to know about coronavirus and how to protect themselves?
So people who have developmental disabilities, or the elderly, are oftentimes living in group settings and congregate settings like nursing homes or some type of adult living facilities. So so unfortunately they have to understand that they may not be getting the visitors that they used to get, and also it's still important for them to wash your hands. They may be asked to eat in their rooms instead of in congregate settings, and it may be difficult for them to understand. And I know it's really challenging now for people working in those facilities. Helping them explain to understand as much as possible about why their routine has to change, because I know that can be difficult in itself to have a routine change, that they're not going to have the same visitors, they're not going to be able to have the same congregate situations, and hopefully they can be provided with maybe listening to music or on the radio, or watching something interesting on their phone, or talking to those people that they used to be able to visit on their phone, or FaceTiming them are have to be creative options to get us all through this.
What do you want to tell the people of Erie County to help them understand how serious the coronavirus is and how to protect themselves?
Well, we are maybe 2 to 4 weeks away from where New York City is in their where they're dealing with their epidemic, and so we see that New York City hospitals are overwhelmed; they're beyond their capacity, and the U.S. Army Corps of Engineers have built makeshift hospitals throughout the New York City area, including I think their Javits Convention Center is going to open up today. They're seeing hundreds of deaths, and so that's going to be us if we are not vigilant with our non-pharmaceutical interventions in a couple weeks. So we really, that should be what our the target is to stay away from that level of illness and death. I mean, we really have to keep on track now before we've reached this huge period of escalation, to make sure that we stay on track with physical or social distancing, washing our hands, staying away from people that are sick, staying away from other people. And there are actually guidelines from the state health department of how long people should stay away from each other. We should give it people who are essential workers. If they're sick, they have to stay, away from their job, away from everybody else for at least 7 days, and the last 3 of those days have to be fever-free. And then when they return to work, they have to wear a mask. And again, during that time, they just go to work, home, work, home, work, home. They're still in isolation. However, they're able to work if they're an essential worker. If you are not an essential employee, you should stay quarantined, and for a good 14 days, just to stay away from everybody else. So I know that's really difficult to do. I mean, 14 days can be a long time, but this is for the good of our family. It's for the good of our community, and this is what we have to do to protect our community and to protect those that are around us that are very, very vulnerable to severe disease.
Can you please give out the Erie County COVID-19 hotline and website?
So our hotline is 716-858-2929. Again, it's 716-858-2929. And our website, our COVID website, is www.erie.gov/COVID-19. And then the map with reported cases of COVID virus. And remember, that's a huge underestimation of the actual number of people, but maybe you can just use it to follow trends. But it's not the absolute number, is www.erie.gov/COVID map.
Dr. Burstein, I appreciate you. I appreciate every one of your employees in the Department of Health and, of course, all of our healthcare professionals. Thank you. Keep up the great work in just trying to reiterate how important this is and getting us the information that we need to keep our families and ourselves safe. Thank you so very much.
Yeah, well, thank you. And thanks for helping to spread the great information.